Hi everyone, my name is Laura Vandenboer and I'm your host of Healthy Living with Laura. Today I am really excited. We have Dr. Kyle Aram here with Shift Family Health Center, and he's one of my colleagues. So I'm really excited to talk to you about what chiropractic is and what you do and learn a little bit more. So why don't you just introduce yourself and let us know what chiropractic is.
Awesome. Thanks for having me. So, as you said, I'm Dr. Kyle Aram. I'm a chiropractor here at Shift Family Health. So, as chiropractors, we are experts in the musculoskeletal system. So, what that entails or encompasses is the muscles, joints, bones, ligaments, and the nervous system.
Okay.
So, we cover all those kind of muscle, joint, pain, aches in practice with a variety of treatments that I'm sure we'll have time to get into as we go.
Yeah. So how do you become a chiropractor? What education do you have to do, and what made you want to get into chiropractic?
Yeah. So it's a bit of a process. I originally went to the University of Guelph and took biomedical science there.
Okay.
And then it wasn't until later on in that undergraduate degree that I decided that I would enjoy the practice and the lifestyle of being a chiropractor.
Right.
So then after that undergrad, I moved to Toronto and attended the Canadian Memorial Chiropractic College. So that's the only English-speaking chiropractic college in Canada.
Okay.
So that was another 4-year doctorate degree in Toronto. So it was a long process, but here we are. So it's exciting to be starting my practice here in Fergus.
Super exciting. So how do chiropractors treat their patients? I know there's kind of a few different ways, but why don't you kind of tell us about that?
Every chiropractor will treat slightly different. Traditionally, we're known for our spinal manipulation. So that's when we're taking the joint through a certain range of motion, and we're restoring its physiological range, decreasing muscle tension, and decreasing pain in the process.
Okay.
So that's what you'll typically hear of when you go see a chiropractor.
Okay.
Here at Shift, me as well as Dr. Kira Bailey, we use a combination of modalities. So depending on the patient and the condition, we do shockwave therapy, we do low-level laser therapy, we also do acupuncture, some soft tissue therapy where we spend some time loosening up the joints and the muscles themselves, and as well as incorporating some forms of active care. So prescribing exercises to work on posture, work on range of motion, and strengthening that area in question.
Right. And a lot of chiropractors are a little bit different, even between yourself and Dr. Kira. You guys do treat very differently. I've seen you both. But what do you kind of like to focus on? What is your ideal?
Yeah, so I, as a previous personal trainer, I do like to incorporate a bit more of that active component. First, once I achieve getting the pain levels down, restoring that range of motion, then I like to strengthen the area and get people moving and functioning better, right? So working on not only getting you out of pain, but performing better and preventing reoccurring episodes of pain. So for instance, if it was a low back condition, you'll often hear of strengthening the core, right? The more active and strong your core is, the less pressure and need for the low back muscles there is. So it's about kind of strengthening that area and make sure the body's moving properly before we get to that.
Okay, great. So I think we're going to go over some myths that people hear about chiropractic, and we're going to debunk these myths. So we'll start out with chiropractors. Do they only treat back pain? A lot of people think that's the case.
Yes. So a lot of people think that, but we do actually incorporate treatments that will treat conditions of the entire body, right? So the entire musculoskeletal system, as I was describing earlier. So some of these conditions might include, tennis elbow, so tendinopathies of the elbows, shoulders. We treat headaches, concussion management, hip, knee issue, running knee, plantar fasciitis. These are some things that using the combination of different modalities we have at our disposal that will treat. Typically, we see conditions involving the neck, the low back, the mid back, but there's much more in the scope of the chiropractic practice. Yeah.
So if somebody were to come in with, say, a new ankle sprain or an ankle injury, is it more long-term stuff that you deal with, or is it short-term, or is it both?
It's both. Okay. So when people come in with an acute injury, we get them on an acute plan of management, right? So that may involve seeing them a bit more frequently, really, in that instance, if it's an acute ankle sprain, decreasing the level of swelling, starting to get things moving, initiating the healing process with either acupuncture, laser, things like that. And then as, that person's condition improves, then it's a matter of mobilizing the joints, maybe incorporating some active stretches or exercises that they can do at home to supplement what we're doing here in the office.
Okay, perfect. So myth number 2, a medical doctor must refer you to a chiropractor.
No. So, so as a chiropractor, we are titled as a doctor and doing the 4-year doctorate program. So we are primary healthcare providers. You don't need a referral from a medical doctor or anybody else. You can come off the street and see a chiropractor. We have that ability to assess the patient, diagnose, and then develop a treatment plan. So, we'll see people from the first step and all the way through the treatment plan until their recovery.
Right. And I mean, a family doctor or medical doctor might refer to a chiropractor, just that's where they think the treatment should go, but it's not necessary.
100%. Yeah.
Benefits, do you need a referral for benefits to be covered, or for your services to be covered under benefits?
No, people will often use, some people are obviously paying for services out of pocket, some people have private insurance plans. And back to the whole referral between the medical doctor and the chiropractor, a lot of the times I'm co-managing patients with their medical doctor, right? So I like to, sometimes I'll write a letter to that medical doctor and just say, hey, here's what I'm doing. Let's work collaboratively to really, work best with this patient. And so I know what he's doing or she's doing, and they know what I'm doing. So, we can provide the best care for that patient at all times.
Yeah. And I think that's important because a lot of, we need to be on the same page. And more often than not, somebody's seeing more than one practitioner or one professional. So everybody's on the same page. It's always benefits the patient. So that's good. Myth number 3, once you see a chiropractor, you have to keep going back to the chiropractor.
Yeah, so, it's ultimately, it comes down to, we create a treatment plan and a diagnosis for each individual patient. So, some people, they're coming for acute care. Some people, they're coming for a chronic issue that may take a bit more time, right? There's no obligation to keep coming to see a chiropractor. Although, do I believe that there are people that could benefit from regular chiropractic care? Of course, right? There's some people, whether it's their job, their lifestyle, whether they're a trades worker or they just have a lot of physical demands in their job, they need to be taking care of their body.
Right.
And so we provide them with that ongoing care to make sure they don't get to the point where those symptoms are accumulating so much that they are in really severe pain.
Right.
So it's a matter of just keeping them healthy and making sure everything's moving well and functioning well, so they don't get to that time where they really are experiencing a lot of pain.
And things can change so quickly too, right? If somebody has a bad day at work where they're really tired and they're not keeping proper form, then it might be that they need to see the chiropractor a little bit more regular to stay on top of that. But I think that's great. Myth number 4, adjustments hurt.
Yeah, so generally, no, right? Okay. A lot of patients report that after an adjustment, it provides them with immediate relief, okay? So, and just to describe the adjustment in a little bit more detail, so this is the section of the low back, the spinal segments, okay? So in between each vertebrae in our low back, there's these little joints here and here on each side. So when we deliver a spinal manipulation, you might hear a pop or a crack. That's what often people associate with a chiropractic adjustment or spinal manipulation. And what that is just an air bubble being released from that joint itself. Okay. So, we're not in the business of tearing ligaments or breaking bones. It's just air being released from that joint capsule. Very safe. That's what we practiced for 4 years in technique, is to, learn how to properly deliver that manipulation at high velocity, low amplitude thrust to restore range of motion in the low back. So, typically, like I said, patients, that's why, patients keep coming back because they enjoy that pain relief, and it gets them moving and functioning properly.
Right. And so could you be sore after the adjustment?
Yeah, so sometimes because we are kind of restoring proper range of motion, there will be times where the body kind of will react to that, right? If you've been stiff for a long period of time and you get an adjustment and we're kind of loosening things up, you may temporarily be sore.
Okay.
But then as we progress and you keep coming back and we follow up with treatment, your body will kind of accommodate or adjust to that new range of motion, and you'll feel relief and an increased range and function a lot better.
Right.
But initially, sometimes patients may report that they do feel a little bit of discomfort.
Okay, and because I know that I was sore after the first couple of treatments, but you guys always kind of walk us through what to do. So whether that's ice or Epsom salt bath or anything like that. So it's not like we're on our own as patients. You kind of walk us through that step. Yeah,
exactly. A lot of the times, what my job comes down to is patient reassurance. Right. A lot of people, they hurt their back, for instance, and they think that they can't do anything and everything hurts. Yeah. Yes, a lot of things will hurt in that acute stage, but it's a matter of finding little things that they can do. Whether it's going for a 10-minute walk that day, or applying ice or heat on the low back, doing certain stretches or core stability exercises that are low impact, low risk of re-injury, things like that they can do at home, like you said, to supplement what we're doing in office.
Okay, perfect. Yeah. So why don't we're gonna go through some examples of the most common treatments, and I think you're gonna just walk us through some of those.
Perfect. Okay. Yeah.
Okay, so we are going to go through the 3 most common conditions that you see and how you potentially might work with them.
Perfect. Okay. Yeah. So statistically, chiropractors often see neck pain, back pain, and shoulder pain. Okay. Those are the 3 most common things we see. And at the end of the day, a lot of that comes down to proper posture. Okay. So just to run through your perfect standing posture, I'm just going to have you stand up for me, and we're just going to give people a bit of an idea of what ideal posture should look like. Okay. So first, we want to look at the side profile. Make sure that the ear, the middle of the shoulder, the middle of the hip, the knee, and the ankle are all sort of aligned up, right? Okay. A lot of people present with a bit of that anterior head carriage, and that's what results in a lot of pain. Okay. So that brings us to the first topic of discussion is neck pain. Okay. So due to the introduction of cellular devices, laptops, all that, younger people more and more are coming in with that anterior head carriage, and all those muscles are going to be working against gravity all day long. Right. So a lot of it comes down to not only just reinforcing it and reminding them, okay, let's work on some chin tucks, some exercises. It's getting things moving properly in the neck so that they're able to kind of do it without any discomfort. So a common thing that I will often do for kind of to reinforce proper neck posture and also shoulder and back posture is doing wall angels. Okay. So I can just run through this exercise real quick. So for this exercise, you want your butt, the back of your shoulders, and the back of your head against the wall. Okay. And you want to make sure that your head's not tilted up like this. You actually want that chin down and tucked back. Okay, it's going to feel a bit weird. Sometimes you feel like you almost can't breathe. But that's because we're so used to sticking our chins out. But we're going to really try to practice keeping that chin in. Okay. The next step is putting the back of the elbows and the back of the hands against the wall. Okay. And then from there, you're just like you're making a snow angel. Okay. Right? And
just keeping your arms up against the wall. Okay.
Chin back, keeping it back against the wall.
Okay.
Okay. So not only is this going to remind us to keep that chin tucked, keep that proper posture, but it's going to open up the front of the pecs, the shoulders, remind us to keep our shoulders back.
Okay. And it's just kind of creating that pattern then that's what your body gets used to.
The more we get used to that, the more we'll, when you're sitting at your desk, you'll just remember, hey, let's keep my shoulders back. Let's keep that chin tucked in, right?
It's all about repetition.
Exactly. Okay. And then your body isn't working against gravity all day as you're hunched over.
Okay. Right? Great.
So I guess the next most common thing we see is back pain.
Yes.
Okay. We're sitting way too much. We're not moving. We're meant to walk, squat, do all these natural movements, but we end up in a chair for a long portion of the day.
Right.
So what we often lose is proper hinging of the hips. Okay. So I do another exercise for this. and we'll use this to demonstrate it. So oftentimes when people do suffer from low back pain, those low back muscles are tight, and people's lifting techniques are subpar, to say the least, and they're arching through the spine. Okay. So one way to train hinging at the hips and keeping a neutral straight spine is to use any straight object, a broom handle, a hockey stick, whatever you may have. Okay. And so for this, you're just placing it behind the back like so, and once again, keeping the butt, the back of the shoulders, and the back of the head against it, right? So, and then from there, you're gonna groove and practice the hip hinge. So this is gonna feel awkward at first too, because we're not used to it, but then just trying to come down into a squat, okay? So first you can practice just sitting your butt back like you're sitting on a chair. And then from there, it's coming down into a squat. Okay, grooving that pattern. Okay, so oftentimes a few common procedures for lifting techniques is obviously keeping items close to your body, right? Bending with your legs or lifting with your legs and not your low back. Okay, so all that comes down to proper hip hinging and keeping that spine neutral as we squat.
And again, it's just that repetition so that when you do get tired, if you're lifting all day at work, that your body, that's the natural position that it wants to go into.
You may be able to reach down like this, 5, 10, 20 times. You do that, day in and day out, you're going to start to get sore.
For sure.
Right? So it's a matter of doing and moving properly so that you don't get to that point.
Okay, perfect.
Okay, and then the last one we often see is shoulders. Okay, because of the like I said, again, the posture, our shoulders are rolled in, so they're not opened up and free to move like they should, right? As we're typing, sitting down, the neck, the shoulders, everything's kind of hunched forward. So, and one thing I'll demonstrate with you if you want is, so hunch forward like you were if you're in front of a laptop all day.
This way.
And then bring your arm up like this with your thumb up as high as you can. Okay, and bring it down. Now stand up perfectly straight, shoulders back, relaxed, and now bring that arm up as high as you can.
Okay, you can go a lot further.
Go a lot further, right? So it comes down to is posture, so important because that dictates how our body moves and how much shoulder range of motion we have, right? It opens up the space in between our clavicle and our acromion, the two bones up on our shoulder, and the head of the arm, the head of the humerus, and the bone of the arm up here. So it really will open up and allow you to get a lot more range. Okay. So once again, not that necessarily people are slipping and falling and leaning on that shoulder. A lot of these injuries are just repetitive strains or just things that accumulate from poor posture. Right. So a lot of the times, I deal with obviously a lot of sports injuries or slips and falls, things like that. But oftentimes people will say, I don't really remember what brought it on. And these are repetitive strain or accumulative injuries that just occur with daily just micro traumas that then present as full-blown shoulder pain or hip pain or low back pain that can be avoided with just proper stretching, coming in to see your chiropractor, and just moving properly throughout your daily life. So those those three things are the most common things we see, and they can easily be avoided with just some proper assessment of the body mechanics and kind of giving people the tools to train the body to move properly.
Okay, that's great.
Awesome. All right, so luckily Laura has been a patient of mine, so we've done some physical examination, some history, and determined that cervical manipulation will be quite beneficial for her. So this is something we've done before, and I just wanted to walk you through a neck adjustment so you get a better idea of what it is and exactly what the chiropractor is performing here. So initially, I just palpate, find any sort of restrictions in the neck. You're also using your hands to assess the soft tissues, so that's the muscles and just the general tension that the patient is experiencing up here. Okay, and then as we go along, we then perform the cervical adjustment. So this is where we ask the patient to relax. The more they're relaxed and the more we educate the patient to just relax, remain calm, then we won't be fighting against their muscles themselves, right? So as long as they're relaxed and I use my judgment before performing the adjustment as to whether or not the patient is comfortable, whether they're relaxed, okay? So a typical adjustment of the neck is like so. And just like that, okay? And then I'll usually, if needed, on the other side, we'll also assess for any restrictions, any tenderness, and then perform the same manipulation. Good, and just like that, okay? So you may hear some of those clicks and pops, and like I said before, that's just air bubble being released from the joint, and usually this is quite relieving for the patient. And then after that, we'll have the patient come on up and sit up, and move their head side to side.
Feels good.
And that's what we do, okay?
Okay, so chiropractic has been around for a long time. Are there any new developments in what's going on with chiropractic right now?
Yeah, so the Canadian Chiropractic Association has developed a sort of a program, website, and resource for both patients and practitioners called the Canadian Chiropractic Guideline Initiative. Okay. So this can be accessed online if you type that in or type in CCGI. Okay. And it has guidelines for sort of each area of the body. So what practitioners should be doing for neck complaints, low back complaints, shoulder, hip pain. Okay. Also videos and descriptions for patients. So it'll have a whole tab there of resources for patients to utilize, and it'll have exercise videos step by step for such topics as like neck mobility. Yep. And then it'll progress. You go to the next video and it'll have neck strengthening. Right. So it's a really, really good resource if you want to just learn more about chiropractic, learn what you can do to kind of alleviate some of that pain, right. And provide you with any further education that may help in recovery. So it's really good. It's also compiles a lot of the new research that's coming out. So they published some new guidelines concerning concussion management, physical activity during pregnancy, a lot of these new developments, right? So with concussions, for instance, now we're implementing more exercise early on in treatment, right? A few things like, waking people up, when they're falling asleep the night after a concussion, or keeping them in a dark room with eyeglasses and earplugs for weeks and weeks on end. We're learning now that that's not the best way to manage these cases, and implementing some more earlier progressive exercises can be a lot better for the recovery. Okay. And this same thing, it all comes down to the recurring theme of move more, exercise more.
They can go on there and see how it actually would be beneficial for them.
Yeah, exactly. If you ever, if anyone's ever confused about, should I go see the chiropractor, or, can they treat this? That's a good place to start to see if, it's something that's within our scope, something that we could, really help you with. Right.
Well, that's exciting. So if somebody were to book in with you, what would your initial assessment look like? What would you kind of cover in that appointment?
Okay, so the initial assessment really is comprised of two main areas. So the first being the history. So that's where we really sit down, talk with the patient, get to know them. Okay. Right? We go through any previous health concerns, any diagnoses they've received from their medical doctor, any previous trauma, any motor vehicle accidents, fractures, dislocations, anything like that. Okay. Get to know what they do for a living. So, what stresses do they have in their daily life already that could be, exacerbating their pain. Okay. And then everything down to things like what medications they're on, allergies, what's their diet and exercise like. Okay. So really just, spending that time to really get to know the patient, what's aggravating for them, anything they've been doing to manage it, and then getting a good idea of what we need to perform in the physical examination.
Okay.
So that brings us to the next part,
Yes.
which is the physical exam. So that's when we actually will get the patient up, look at the posture,
Okay.
check their range of motion. Okay, so if it's a low back complaint perhaps, see if they can reach down and touch their toes.
Okay.
Can they extend back, move side to side without pain? So those are the basic range of motion kind of assessments.
Okay.
Then we usually get them up on the chiropractic table. We do some orthopedic testing
Okay.
to find the root cause of that issue, right? Whether it's, some nerve impingement, whether it's just a muscular condition,
Right.
A strain type injury, or if it's a ligament sprain. Really try to find out exactly where and what is generating that pain. There's sometimes that patients come in and it's just my shoulder hurts, and it's just I feel it and it's in here, and they can't really pinpoint the exact area. In those instances, sometimes that can be referred pain from, let's say, the neck.
Okay.
So that physical exam is really good for kind of finding out where exactly their pain is, so that we can better diagnose and then treat the condition.
Right.
Okay. So then once we're done that process, we will obviously then compile everything from the history, from the physical exam, and then provide a diagnosis. So whether that's in that first visit or the second visit, we then provide a report of findings. So that's the period where we, kind of educate the patient on what we found, what their diagnosis is, and then what we can do.
Okay.
Okay. So we'll sit down, we'll say, okay, this is what I found in the history. You were involved in a motor vehicle accident, you have shooting pain down your arms. This is what your diagnosis is, and these are our goals and your plan of management. So, I'd like to see you two times this week, next week, and then we'll reevaluate things, see what the duration and frequency of care might be, depending on patient recovery. It's always just that whole development of patient management.
Right.
It's an ongoing process. Nothing's ever solidified or written in stone.
Yep.
We just work with the patient, see how they're moving, see how they're recovering, and then implement a frequency and duration of treatment.
And then it's all kind of individualized for what that person's going through.
Exactly.
Right?
Exactly. There's no cookie cutter style treatment. It all depends on their specific needs and how they're responding to treatment. Right. If we ever get into things and I've been seeing them for 2 times a week for 3-4 weeks, and we're not getting the results that we want, then we look at the treatment plan. Okay, see what can we revise or add in or take out.
Okay.
To make sure we're getting that patient to where they want to be.
Okay, that's awesome. So if somebody does want to book in with you, how do they find you and how do they book an appointment?
Well, they can either visit the website, shiftfamilyhealth.com. There's you can book online. You can also access on that website, there's a phone number. Call in. We have reception here most business hours, Monday through Friday.
Perfect.
So call in. So people that are who have never been here before, looking to book an appointment, they have to book in for that initial assessment.
Okay.
Right. That's key to creating a diagnosis. Finding that root of the problem and then treating. Right. We don't want to just hit the ground running and start treating right away. We have to find out what the problem is first before we start treating.
So you take a little bit longer for that initial, and then
the initial appointment is roughly about an hour.
Yep.
And then as they come in, that second one, half an hour. To try to educate the patient and go over any questions they may have.
Perfect.
And then we'll continue with treatment after that. Yeah.
Perfect. Well, sounds good. Thanks so much for talking us through chiropractic and
no problem.
Teaching us a little bit more about what's going on in your field. Obviously, I'm happy to host at Shift Family Health Center and show what's going on. So thank you so much again.
Yep. Thanks for having me. I really appreciate it.
You're welcome.
Hopefully we debunked some myths
Yes.
and educated a few people on what I do as a chiropractor and things that I might be able to help that they might not have thought
I
about.
think you
before.
did just that, so that's perfect. If you are a healthcare professional watching and you would like to be a guest on the show, you can email me at alignedpodorthics@gmail.com. Thanks for watching.